Hi,
And
this is
say
Jenny
hi.
Bair of the J Bair Company and also Perfect Practice Coaching and Consulting. And today I'm here with my new friend, Dr. Claudia Sandoval. Hello.
Hi. Like this.
Of Points Acupuncture and Dry Needling in New Braunfels,
In Broncos.
Texas. So if you're not sure where New Braunfels is, you need to find out because it is a wonderfully cute little town. And it is right between the edge of, or well, it's between Austin and San Antonio.
In San Antonio. That's right.
And tons of trees. It's just a cute, cute little town and lots of German
It's a cute
settlers.
little
So
town,
the
big
food,
population.
oh, what'd you say?
Cute little town, big population.
Well, that's true. It was. I'm thinking of New Braunfels when I was a student. It was a little town, but now, yeah, there's a lot of people, and I would say they're kind of known for their good German food, right?
Yeah.
Yeah.
Yeah. Good.
So let's talk about you, Dr. Claudia. I met Dr. Claudia last fall, and I'm excited that I met her because she is very zesty. She's full of life, and I would say she is. She definitely has a really fun mothering energy. She's not a stick in the mud mother, though. She's very fun and articulate, and I feel like she's a person that's going to try new things. And she's going to really work with people based upon their personality and just how they are in the world. So I'm excited that I know you. And so I am glad that we're going to do this interview to let everybody else know about you. So, one of the things that sticks out to me about your practice is that based upon where New Braunfels is, there are a lot of vets, people from the armed services. So, tell us a little bit about your work with all of the vets in the area or active.
That actually started about 3, 4 years ago. Now we're going about, this is probably the fourth year where we've been doing it.
That's awesome.
At the time, the people that were working in my office, including myself, we were married to veterans. And so this area, most of our veterans that live in this area here, they live about within the same a few towns over. So it's
Right?
all in the same area, but they all had to
Right.
go down to Audie Murphy for treatment, which is far. Of course, that's way down in San Antonio. And so there was nobody really offering those services here in this vicinity. So 3 or 4 years ago, I contacted the VA, said, I'm available if and I signed up with them, and we've been treating veterans for acupuncture and offering through their community care service network.
Well, so
Um,
tell us how is acupuncture helpful not only for everybody, but
yeah.
specifically your veteran population?
Oh, it's they do amazing. I can't say enough about it. Every time I get somebody in that's a it is a veteran and they don't know about it. I immediately say you got to go, take advantage of their services with community care, not only for acupuncture but for chiropractic care. And they offer Tai Chi lessons and they offer sometimes massage therapy. It depends on who your coach is with community
Right.
care network. But it's been wonderful. I mean,
That's
they
amazing.
they do so much for our veterans outside of the Audie Murphy, basic care. This is more of the adjunct therapy, you would
Right.
say. So more of the like the add-ons, right? And so when we get a lot of the chronic pain patients. So patients that don't want to be on medication
Mhm.
24/7, patients that their only option is either another surgery, which most of them don't want to go another surgery. And this has it's turned their life around for a lot of them. And it's not only the pain aspect of it, because we do work with musculoskeletal, but also the nervous system part of it. So, and I always tell whenever we get somebody new that comes in, my front staff, I always say, when the crotchety old man come in, because a lot of our veterans are
Yeah.
older, and they're veterans, you gotta have grace and you gotta be patient because a lot of
Right.
them are in pain.
Right.
And when people are in pain, it's fun. And when you're in pain 24/7, it's not fun.
No,
And by the third, fourth visit, they come in here and they're a totally different person. And
that's
that's I think one of
amazing.
my favorite. Yeah, they come in and they're just like either blown away or they're like this. It's been working for them, and so they are finally seeing like better results, I guess, or they're finally seeing they're getting taken care of. And so
Right.
they come in and their personality changes. They have a better outlook on life. They can do more. They're like, I was able to walk a little bit further
Right.
without pain. I was able to
Right.
work on my yard. I had one patient who was like, I was finally able to, my whole backyard was just full of weeds and just dead, right? And so he's like, I was finally able to go out there and do something, and that feels good. It's
Yeah,
it's
that's
it feels good
amazing.
for them. Yeah. So that part of it, it's been really rewarding. Yeah.
And I know that you're not just obviously when you're doing acupuncture, herbal medicine, all the things that you do
Yeah.
there, you're also affecting their emotional, mental, probably spiritual health, their soul,
Yeah.
because, depending on how they participated or how they're, in the past or currently, where they've gone in the world, what they've been a part of, I would imagine there's some PTSD
A lot.
related to, for a lot of vets.
And
And
we do treat
so
that.
yeah, so what are some of the things that you have? I mean, I'm prompting you because there is this really cool thing you have besides needles at your
Right.
office for probably for PTSD, but um, tell me some of the things that you can do for PTSD there.
So for the veterans themselves, we do offer vagus nerve stim. So that's another aspect. So we do put them into a machine, and it's a vagus. It's specifically a certain frequency type of machine with needles. They do have needles, and it's basically needles that go in the ear. The machine gets hooked up to those needles, and it sends a discontinuous frequency. So it turns on for a few seconds and then it turns off. Turns on for a few seconds and turns off. So we're almost, I'd say, tricking that nerve, but almost tricking that vagus nerve
Right.
to reset. I call it a reset.
Right. I
So
love it.
most of the people, it's been shown in studies in Oregon that most people end up releasing serotonin afterwards, and it's a way of rewiring that part. It's the neuroplasticity part of it, right? Rewiring that
Right.
part of the brain that tells them that there's a bear outside and there's no bear, there's no threat, like you're okay.
Right.
So it calms that nervous system. We also have we just brought in a sound bed, which is one of our favorites so
Woo!
far. Yeah, sound beds. It's a frequency bed, so that they lay on top of it. Headphones go on. The sound bed plays the frequency. The headphones play the frequency, and then there's another unit that sits on top of their abdomen, which is most people know are one of our serotonin
Hmm.
areas, right? That can produce serotonin is in the abdomen, right? The gut area. So another component goes on top and it plays the same frequency. And so you're almost surrounded by this sound. Anything from solfeggio type sounds to, everybody likes like the 512 frequency, the 512 hertz
Hmm.
frequency, or just sometimes we have something as simple as like rainforest type music. Um, Again, it's rewiring that brain. It's rewiring that part of the nervous
How does
system.
that work?
Yeah.
So, I've heard those words before in what you're
Yeah.
saying, and I've read stuff on frequency, obviously, because, I've been looking in my own
Yeah.
healing. But explain that to somebody that doesn't know about that. And like when you're saying the vagus nerve, some
Yeah.
people may not understand how important that is. So could you touch on those two things
So
again?
the vagus nerve is that part of the nervous system that tells your body to go into fight or flight. It's for our benefit, really, right?
Right,
It's
right,
if it tells us that there's a threat, and so everything goes to that part of the brain that says, okay, you got to run, or
yeah.
um, or
Or
fight,
fight,
right? Stay and fight, which
or
most people are in that,
that was
or
freeze. That was
or it's
freeze.
time to relax, or it's time to just, or sit at the beach, just chill out.
Yeah,
And that's why they call that the rest and digest too, right? When you're in the relaxed state, that's when your abdomen's finally working. And that's why a
exactly.
lot of people that are in that constant state of like fight or flight, anxiety almost, right? A lot of those people tend to have digestion issues.
Right.
We're not giving the digestion, like, take you out of that fight or flight, give that digestion a nice little like rest and digest. It's, so it's just a simple part of that. Yeah, it's a nervous system, but unfortunately, I think a lot of people are in that fight or flight, and they
I
stay
would
there.
agree.
And they
I would
stay there.
agree.
Yeah, yeah.
So, how long is this sound bed? Because it sounds fascinating, and I didn't get to try it when I was at your clinic last time, but I really want
Next
to try
time
it
we're gonna
this
do it
time.
next time.
Okay, so how long is a session?
About 20 minutes, 20,
Okay,
30. If you're used to it, we'll take you up into like 40, right? It depends on the person.
can it build up?
And it's basically tapping into those, is it the gamma waves? So it's different delta, gamma,
Alpha, alpha.
alpha, yeah, these waves. So it's the sleeping wave.
Right.
Um, and I had one of my colleagues, um, medical doctor that came in, and we were discussing that. And I had a patient that came in and used it, and she said, "Man, that felt great." Like she was relaxed afterwards. She said, "Oh, it was nice. It was relaxed." She said, "But what I noticed that I went shopping afterwards, and when I was shopping, I had no pain." So I was walking around
Oh,
the
that's
store and
cool.
I had no pain. And normally she's like, I'm hurting everywhere. And we didn't treat her with acupuncture. We just treated her like she just came in to use the bed. And we were discussing that, and he said, well, that makes sense because when your brain is put into that sleep mode, kind of without sleeping, those brain waves are activated. Um, you're not in pain when you're sleeping. Most people, I mean, when your brain finally goes into that deep sleep, your gamma waves are activated. You're
Right.
not you're not you're not in pain, obviously. And so it makes sense that that brain almost held on to that part, right? Telling the body you're fine for however long she was out there. And so that was kind of fascinating. Like,
That's awesome. Well, let me ask you this. Do you use herbs with some of your
yeah,
people that are trying to help them with maybe they're having trouble with sleep or
absolutely.
they're having trouble settling their mind beyond
Yeah,
the
absolutely. Yeah.
Yeah, so
And
tell
one
us
of the
a little
things
bit about what you would
I
use
love,
for some of those.
so herbal treatment is one of the things that I always tell people is that Chinese medicine, I love Chinese medicine.
Me too.
It's they're medicinal, right? So I know there's a lot of herbal therapies, you want to call them, out there, or people that put together formulas like for sleep and like
Okay.
flowers and chamomile, those are great. I actually love those. But this is more to reset the system. So it's actually working internally with your body. And so that's why it's very important if you are going to use Chinese herbs to go to a practitioner that knows
What they're
how to
doing.
how to how to prescribe them, because we're doing it to your specific body, to your specific constitution, because everybody's different. So what works for one person for sleep, which is great, could work for this one, but we might need to tweak it a little bit for whatever's happening with them. Um, and they are medicinal, so they don't always taste great, right?
What?
But but they work. And
Yeah.
usually I keep somebody on herbs maybe 2 weeks, maybe 2, 3 weeks at a
Now,
time.
are you
Yeah,
blending them to do the teas or do you do the little
it depends. It
balls
depends.
or
Most people prefer capsules,
Mhm.
right? You just take them and go.
They do smell
Um,
better, girl.
they do, yeah. And then right now I do have a formula for allergies. I do have that
Oh,
and
perfect.
store in house. And most people get that one for when they're having a nice run of the mill with the allergies in
Right.
this area. But um, those are loose leaf raw tea. Like those are raw teas. And
Okay.
there's and it's the girls kind of when I first put it together, they were asking me about it because I have 3 different bags in it, and it's on purpose. So the first bag, because it's the root, has to be simmered for about 15 minutes, and then the second bag is added, and that's for about 5 to 7 minutes because it's the plant part of it, and then the third bag is added at the very end when the the formula comes off the stove, because now it's just steeping. So it's like you're going from the root to the plant to the leaf,
Oh,
right? And
that's
so
cool.
so it's like, and that's the difference between Chinese medicine and other herbs. Like we're purposely changing things. We're doing, and they have to be cooked a certain way. And so that's why I put those together that way. But they're effective.
Now, do the allergy ones just for the audience out here because almost everybody in this area has allergies. Does it taste pretty good?
It tastes like herbs.
Okay, it tastes like herbs. Okay, all
Yeah,
right. Well,
yeah. I mean, it's not. I don't think it's bad. I think
well, you're
everybody
using
should drink 1 cup of tea a day,
what
especially
type?
green tea.
Green.
Green tea.
Why?
If you have dinner, a cup of tea at the end, and go
Uh,
for a walk.
Tell us why.
And the digestion, what it would do for your digestion, it's amazing. Yeah. So if you have dinner, you'll steak and fries, whatever it is, boil yourself a little cup of tea, little green tea, go for a walk. You'd be amazed with that. What that's for your digestion.
That's awesome. So, is 1 cup enough if somebody was,
I mean, you could do more of it.
yeah. So, do you have teas there?
We
Like green
do.
tea? Okay,
We offer that.
awesome.
Yeah.
And another thing that she has at her practice that I want to try also are those NAD patches. So tell us a little bit about those.
Oh, I
And
love them. So
tell us,
everybody's doing that now. Everybody's
yeah,
doing NAD injections,
bet.
BPC 157. what else? Glutathione, so
Uh-huh.
they're doing these injections, and a lot of people, I love them because they're a little bit more, uh, in my opinion, they're more affordable to do this way,
Yes,
and you do
right.
it yourself. So you don't actually have to go to a clinic to get injected. You come here for the first one because we show you how to put it on, and then once it's on, you take them home, and you already know how to do it because we've showed you how. And for the first set of them, we do 3 days worth. So you do one patch a day for 12 hours, and then after that, 1 week later, you do another one, you do another one, and it's 6 patches total. So it's about 4 weeks of patches. They work just the same as your injections, if not better. So usually when you get like an NAD injection, it stays in your system for there's a time lapse that's active, right? So it's not, so like for example, BPC 157, it's not active for more than 15 minutes in your system.
Oh,
So
wow.
once those 15 minutes are up, like your body's done what it has to do with it. It'll continue working, but it's not a continuous, I guess. It
Kind
doesn't
of
go
not
past it.
continuous dosing, or it's
Right,
not
right. Well,
keeping
this
on
one
going.
is. So this one actually pumps a little bit at a time into your system.
Oh, a
So
little
they're
baby bit.
transdermal
Okay,
patches. Yeah.
gotcha.
So it's like it'll put a little bit in and a little bit more, a little bit. Yeah. The girls that have tried it, they're like, I love that stuff. Yeah. Because they get energy, they feel good afterwards. Yeah.
Okay, so some people don't know. I mean, yes, if you're kind of a biohacker and into that kind of thing, you're going to know what NAD does. But let's just tell some of the people that
So
don't know, what does NAD
NAD is
do?
it's a longevity, right? They talk about longevity. So as we
Mhm.
age, it's a telomeres. It's the
Right?
DNA is the telomeres at the end of the DNA. It lengthens them. It gives you a little extra boost, right? So NAD, um, for lack of better, it keeps you young. It's a peptide, keeps you young.
Hmm.
So it does boost your energy. It gives you that, so it gives the cell that extra,
Boost.
yeah, boost, the extra oof.
Oof. We all
Oof.
need that.
Your mitochondria tells it go, 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 right? It
That's
works.
right.
Yeah. And
I love it.
it's I like it. The girls love it. I love it. I mean, it's one of those. It's really hard to explain because so NAD is one thing, and then like glutathione, we have one that has glutathione in it, and
Okay, so
glutathione is
tell everybody about that one. I
that's an antioxidant, right?
love
That's
that
the
one.
thing that goes in there and like takes all the bad stuff out and keeps again. And then the NAD comes in and it gives you a nice little like reset, right? And it gives you longevity, more life, more
Are they in
energy.
the same patch or they're different
Yes,
two
they're in the
patches?
same patch.
Even better. Okay.
Yeah. And
I'm
then FBPC, one of them has, that's why I like them too, because they're combined. So it's not just the NAD, it's combined with BPC 157 and glutathione, or KPV is another one. It's another
right.
peptide.
Right.
KPV is another one. And that one is a anti-inflammatory.
Yes.
So if somebody has Hashimoto's, autoimmune, lupus, those people do great on the KPV because it
Right.
actually goes in and reduces inflammation in the system.
Hmm.
They love those. Yeah. I love KPV for that.
Yeah, no, that is good. The only contraindication with that one, right, is anybody that currently has cancer can't do that one.
Correct. Well,
Um,
it's not necessarily contraindicated, but I personally would say no. On the KPV, the BPC 157.
yeah, yeah,
That's the one I would say, yeah, let's just not hold off on that for a minute.
yeah.
Because it does tell the cell to return over, right? It's literally
Yep.
telling the cells turn over, especially for so BPC was initially it's actually a peptide in your gut itself right now.
Mhm.
That's the way that's where it naturally exists. Sorry.
Right,
Um, but it diminishes over time. And so this is almost like adding a extra in there. And what it's supposed to do is supposed to regenerate cartilage,
right.
right? For like tendon repair and stuff like that.
Mhm.
But
And the lining of
obviously,
your intestines too.
it's telling something to regenerate,
Right,
right? And so
exactly.
by giving it that signal, most of us are, at least for me, I'm like, let's just stay away from that for while if we're in the cancer area. Yeah.
So how much are the patches to do the whole cycle?
The whole cycle. So each one comes to about $66. So
Yeah,
about 400 for
yeah.
6 of them. Yeah.
So if you think about it, if you're trying to do all of those that she's talking about, I mean, even, even in a capsule for BPC and KPV, that's usually around 110 dollars retail just for that. And,
For an
the
injection,
injection
really.
is even more.
Yeah,
So she's bringing up a very good price. That's really good. The other thing that I know you have at your practice, now this one, is in the back room, and sometimes you allow people to sit in there and wait, but you also are now having little sessions in that cozy little room with the massage chair.
That's right.
I forgot what you
Sometimes
call it. Each
it,
room
we
there
just call it
has
the
like
massage
a,
chair. It's just a massage chair. We just call it that. Yeah. Especially when and I think that's one of the we joke with the veterans that that's the only reason why they come see us now.
oh, is the
Okay.
massage chair?
Because sometimes and some of them will come in a little bit early just to do that. They're like, is it available? And it is a first come first serve. But most of the time, oddly enough, it's open like for that next person, right? So,
No, that's
and that's just
awesome.
one of those things where if we have a little bit of extra time, or like just go in the massage chair. And
Right.
what's really interesting is that sometimes we'll put the spouses of veterans in there because they come in and sit with them, I guess, because they want to see what we're all about. And then we're like, come on, you don't need to sit here with, let's just get you in there.
Yeah. Go in the
So most
massage
people, I
chair.
think that's why uh, we always joke around about how the girls are great. I have the best staff. I really do. They love, you could tell they love what they do, right? And that's what I wanted. That's what I've always wanted. People that care.
Right.
Um, and so I think that's what sets us apart, honestly.
Right.
Yeah.
I,
Yeah,
I
people
think it
they
does.
love coming here. Yeah.
That's
We treat
awesome.
them like people.
Say that again.
We treat them like people versus yeah.
Well, yes, exactly. And and not because sometimes people poo-poo you when you're in pain. I
Yeah.
mean, because
That's
people
okay.
that don't have pain don't understand what it's like to live in chronic pain.
Right.
That brings me to a good thing, a good area, because one of your specialties is actually, uh, uh, gosh, pelvic floor dysfunction. So tell us a little bit more about that, because that often is a lot of people think, oh, everything's in your head.
Yeah, yeah, and I treat both men and women for
Hmm.
pelvic floor, and that's the thing. And people are always surprised about men, pelvic floor and men, because men don't have babies, right? But yeah, absolutely, a lot of men suffer from pelvic floor, and most of them don't talk about it. It's just like, oh, it just hurts. Well, it could have fallen on their tailbone a long time ago, and that it's hard to repair that bone, right? It once it heals, and whether it heals straight or
Right,
to the
exactly.
side. Um, but obviously women with childbirth or what's it called, incontinence,
Hysterectomies. Oh, okay.
and stuff like
Incontinence.
that, right? You can't jump on a trampoline after a certain age,
Right,
and that kind of stuff. But I say, yeah, we can. You absolutely can.
right.
And so that's why I would say one of my favorite. One of my colleagues that I learned with, the way she described it was a hammock. It's like a nice little hammock, right? It sits literally from like the pubic bone all the way to the back, and all those muscles there, they can either get super tight, or weak, hypotonic. And so my job is to go in there and find out which ones are kind of working against each other, right? So I've had situations where the ones, towards the back of the hammock are not working properly, right? So then we strengthen those, but then they're pulling really, so because the ones on the front are pulling too hard, right? Because they're super tight. So we loosen these and we fix these, and then the whole pelvic floor is just a nice little even hammock, and people do great with it. I mean, I
And
mean,
is
I've
that
had
just needles, or is there internal manipulation,
no,
or
I don't
okay,
work anywhere inside. It's
okay.
all external. Yeah,
So they
yeah.
flip, maybe you like in the same
So most of
session
the
you
time
do
it's
both?
it depends on what we're seeing them for, right? 'Cause so pelvic floor includes everything from your diaphragm,
Hmm.
right? Your abdomen, you've
Yep.
got your psoas muscles, you've got um, your back muscles, even your lower back muscles. So all of that's connected. I call it the beautiful Jenga. I call it, you have surgery. Let's say you have as a female, you got hysterectomy or something. You've taken Jenga puzzle and you've pulled
Right.
out pieces here and there. With it's sure it still stands, but it's going to kind of wobble back and forth. So my job is to go in there and kind of fill in that space and hopefully get people to, function better, be better, feel better.
So how do
Yeah.
they even know that they would need that? So you did say incontinence. So that could be incontinence for
Mhm.
a man or a woman.
Or a woman, right?
Uh,
Pain is the
pain,
big one. Big
pain
one.
during
Yeah.
intercourse,
Intercourse,
ladies.
both men and female,
Okay.
really.
And
Yeah.
men too. Okay, cool.
Yeah. Both.
Not cool,
That
but
can occur. So what?
I said not cool for men, but I mean, I didn't,
No,
yeah,
I'm saying
for
that they can
them.
also have pain with that.
Yeah.
Absolutely. I I've encountered all of it really with that. Yeah. It could be uh pain with bowel movements, constipation, diarrhea, both ends. So you've got,
Both
you
sides.
know, constant stools, right? And doctors can't figure out why it's happening. And you're like, I'm tired of doing this all the time.
Right.
And that sometimes that fixes it. You've got situations where you've got constipation or you can't go to the bathroom and people will say, well, we don't know what else to do for you, right? And then I go in there and we tweak a little bit of muscle here and there. And next thing you know, they come in, they're like, oh my goodness, like I can finally go. Yeah.
Which is miserable if you've had either end
Pain,
of
again,
the
pain. Yeah.
continuum, it's not
Yeah.
fun. I've also heard men that were, I had a friend that was a physical therapist in Dallas, and she used to say that a lot of men that ride bikes or women that ride bikes, cyclists, sorry, I know that that's the more
Yeah.
professional term. The cyclists really have a lot of trouble with some of those muscles in
Yeah.
their pelvic girdle.
Especially, and that usually ends up being one of the tougher ones to treat because they end up having pudendal pain, is what they call it. Yeah, and so that's a nerve that kind of digs its way into it's really deep in those muscles. So it's a little bit from the Western medicine perspective, it's a little difficult, more difficult to treat. But it's a matter of me finding. I just have to go in there and find that muscle that's hypertonic and find it and just. And a lot of it's dry needling. Go in there, dry needling. It's a very different dry needling than what people are used to. I don't go in there, go crazy with the needles, obviously.
No,
Um, I've seen that happen, but and then we loosen that muscle, and next thing you know, I mean, I right on the table, I've had people say, "Oh my God, I felt that. I felt that like release immediately, like
that's
years."
amazing.
And I'm talking years, like 10 years of constant pain, and some of them end up crying because they
Because
they
they're,
can't believe they can't believe it's that easy. Yeah,
yeah,
well, easy for them, not for me, but
right, right.
because we got to find it. Yeah,
Yeah. Well, that's awesome. Yeah, I can, I've had it from the other aspect. Well, I have had it for acupuncture with my hysterectomy, but
yeah.
also from a physical therapist. And I will tell you, it's a game changer. If you have problems in your down belows, it
I
is
love,
not fun.
yeah. And I love working with physical therapists because then we can kind of collaborate and say, okay,
Right.
what are you doing? What am I doing? And let's get this. Oh, that's a game changer right there when we work with
Yeah.
them.
I can see how that could
Yeah,
change somebody's life
yeah.
like a
It's
lot.
miserable. It's miserable when and sadly, it's one of those areas where it's almost a stigma. It's almost
Yeah, I
a
was going to say people, you just don't bring that
yeah.
up at the dinner table, right?
It shouldn't be, honestly. I mean, we've got pain everywhere. Why?
Yeah,
Why is that?
exactly.
Yeah. It's just
Exactly.
like mental health someday, because mental health is, it used to be a bad, like, oh, we don't talk about that, but now it's widely talked about, so which is great.
Right. It is good. Right. So
Mm,
now we're going to move to another area that you have
yeah,
in your practice. And this is actually how I met you. I met you from the PRX rep, Siobhan, and I'm probably botching her beautiful French name. But
he's
so
great.
tell us a little bit about PRX. Now,
I
PRX
love yards. Yeah.
can be used for women and men. So tell us a little bit more about that.
So basically, PRX is a biostimulator. So it stimulates collagen from the inside out, basically, right? So it's a technically it's an HCA peel, HCl peel, but the way it's been formulated, it actually sinks deep into the tissue. So you don't feel it, you don't peel, you don't. There's no after.
Right.
You don't walk out hurting, of course. Um, and you don't walk out peeling, you don't walk out red. You literally walk out with a glow on your face. And it changes the texture of your skin. It lifts your skin. It's like we talked about this. I don't think it's talked about enough. I think it's great. I don't want to say it's an alternative to Sculptra, but sometimes I feel like it might be. Only because it's gentler, it's safer.
Right.
Um, it was created originally for burn victims, kids
I
that were
know
burn
that was
victims.
fascinating. I read that
Yeah,
about the
to regenerate skin. and
hmm
and it worked. And so they took this and they said, let's do it for obviously for rejuvenation. And that's basically what it is, a skin rejuvenation treatment. I love it.
Because as we age, just like everything changes, our collagen levels change. Dang it. Like we can't get a win anywhere. And
Oh,
so, how often can a man or a woman do the PRX treatment?
so we usually do the rigid, like the initially, we do 4 treatments, once a week for four treatments, and it
Okay.
should be spaced out once a week. you get your skin kind of used to that, right?
Right.
Um, and then after that fourth week, we do it about every 3 months, 3 to 4 months,
Okay.
typically. Most people come in about 4 months. I've had people that come in and like 2 years later, they look amazing. They really do, and we're doing nothing else but that, right? I mean, it's not
That's
they're not
amazing.
getting injections, they're not getting their skin is literally rejuvenating from the inside. Yeah, yeah,
I've had
it's
one
awesome.
session, but I need more.
Yeah.
Um,
Oh, I love it. I mean, my
yeah,
like
it was nice.
I have like acne scars, of course, my 30s and we moved to Texas, it just went crazy. But those are almost gone now.
That's
Yeah.
amazing.
I love it. It's awesome.
Let's talk about what you have put together over there. You put the
Oh,
PRX Perfection and the, just so I get the name right, because I call it the wrong thing all the time. I want to call it carboxyl, but that's not what it is. It's the
oh,
car.
carboxyl peel. Yeah. It's a,
Oh,
it's a,
yeah,
it's a
okay,
mask.
carboxyl pill. Yeah.
Carboxyl, it's a CO2 mask. Yeah.
Yes.
And
So
so
tell us
one
about
of the
that.
reasons why I did that was because we put together a little package for people. If you want to, we call it the boot camp, right? So we want to get women in, and part of it is because I want to honor women, right? I think, and of course we can fit in the men if we, that's fine.
For sure.
But um, women, we go through so much, I think, in general, and we don't give enough. I don't want to say praise, but enough. What would you say? How would you say it?
Time to reclaim or take care of ourselves.
Take care of yourself, right?
Yeah.
We don't do that enough. We're
Right.
always taking care of somebody else.
Yes.
And so this was the way of like, let's take care of you. Let's honor your story. Let's, tell us about, what's going on in your life. And when you start listening to people, when you start listening to their stories, you're like, wow. And you're still here. And you're still like fighting and
I
you're
know,
still you're
right?
still pulling through so much. Let this be a way to let's show the world how strong you're on the inside. Let's show it on the outside, right? And so
Oh, I love
we we,
that.
we included the PRX, right? Still skin rejuvenation. Let's bring out the beauty, right?
Hmm.
You're beautiful as it is. Let's bring it out. Let's make you shine. And then the carboxyl is just a CO2 mask that sits basically we put it on top, and it also resurfaces the top layer of the skin,
Right.
right? So it's the other one works from the inside, right?
Yeah.
The PRX
PRX.
perfection from the inside starts to bring out that glow. This one on the outside, it's like a nice little it's like a icing on the cake, I guess, be a
And
way of saying it.
you have icing and a cherry because you've also added the red light
Yes.
mask.
And the red light type, yeah, on top of that, yeah. Red light mask, we're adding one micro needling session with that to really, so
Okay.
when we micro needle and then
Week
add the
two.
PRX on top of
Okay.
that, I'm like, it's so great. And then
Why?
on
Tell us
top,
why that works so well. When you do the microneedling and then you put the PRX on top of it. Tell us why that works so
so
well.
you're almost like giving it a boost, right? So we're giving that, so we
It's
micro
like
needle the
soaking
skin.
in.
Yes, yeah. And then but it's a weird way of doing that with the micro needling. Because a lot of people, that's why they do micro needling, right? They go in there and they create those little
Right.
uh
Divots. Not divots. That's not the professional. That's not the aesthetic word,
word.
but small holes.
Little micro injuries, right? To get
Yeah.
that skin to stimulate. We're stimulating that skin to turn over, right? That's what we're doing. We're telling it,
Right.
hey, little poke, 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 stimulate that turnover of cells. And so on top of that, we're adding the PRX. So really telling it to like, so it's almost giving it a boost. And
Right.
then on top of that, we're adding the carboxyl for the top layer. So
That's
so I've
amazing.
had a couple sessions doing that recently, and they're surprised that they're not red. Because usually when you go get microneedled, I mean, it's red. They
Right.
walk out of here without any redness. They can still feel it because if you've ever have you ever had microneedling?
Yeah. Yeah.
When you walk outside and if the air hits you, you're like, whoa, you feel it on
Yes.
your skin,
Yes.
right? So they feel that, so they can tell it's happened, but there's no redness at all. So
Right.
they love it. They're like, yeah, that's awesome.
And she's not okay. So week one, let's run you through the things. So week one, she's right. You get your PRX, you get the
PRX
red light, and you get
and the
acupuncture,
carboxyl
and the
and
carboxyl
acupuncture, and we're throwing acupuncture
and
in,
acupuncture. And
right?
then week two, you're going to do the microneedling with PRX to stimulate your collagen, the CO2 lift, acupuncture renewal, and we're going to top it off with the red light therapy.
Yes.
So she's got on her website, she's got a really cool picture of that red light mask that kind of goes from here to here, it looks like.
Well,
Yeah.
the Saluma, yeah.
Oh, say it again.
It's a Saluma red light. Yeah.
Okay, yeah, it looks
One of
really
the nicer
cool.
ones. Yeah.
And then week three, that is going to be the strengthen and rebuild week, and that is PRX stimulator with red light therapy, acupuncture for wellness, and also you're continuing the NAD patches during this time. And then week four is restore and finish strong. PRX, you got your CO2, your acupuncture, and you're continuing with the patches, right?
Yes. And those you continue at home. But yeah,
Yeah,
it's a big difference. Yeah.
yeah.
I'm excited.
So
I'm excited. We have actually more than a couple now, but we have a few people that are on board, and the stories I'm getting are they're pretty cool. Yeah.
awesome.
Yeah.
Well,
Yeah.
so she has created this all. What we wanted to do was we really wanted to offer a lot of things that Dr. Claudia has uh, that complement each other and putting them together in a package so that you're getting the
Nice.
inside and the outside coming out, and you're taking time for yourself to
Yeah.
bring out that inner beauty. So this would all be valued at $2,100.
Okay.
And she agreed to a wonderful boot camp enrollment price of 1497.
Right.
Correct? Yep.
Right.
And so that brings us to we're going to have a wonderful event at Dr. Claudia's on March 20th from
Yes.
9 a.m. to 2 p.m., correct? Yes.
Yes.
And she's going to have her staff there to answer any questions about any particular service, since they are very familiar with it. But I'm going to be there and
I'll
meeting
be here,
people
and I'll
and
be here.
talking to people, having fun, making
That's right.
friends.
And
And
then the sound bed was available. We're gonna offer a free if you want to, for I think it's 7 minutes. We've
yep,
decided like come on in, give it a whirl, and most people will actually feel that in those few minutes. We've kind of timed it ourselves. Like where do we hit the spot? Oh, there it is.
that's
So
amazing.
yeah,
So listen, you want to come
just a
by.
little like try it.
You want to come try. Is it called Sensa or Zensa? The sound
The
bed.
sound, Zingora.
Oh, Zingora. Where did I get
Zingora.
that?
I love that. So the psychologist, psychologist. Oh my goodness. He's got a PhD in psychiatry. I was like, I believe.
Yeah. Like kind
Mr.
of
Justin.
listen,
He
it's Saturday, people. We're
right.
we're doing the best we can. We're having
he
word trouble today,
his
but give us a
beds,
break.
but no, his beds are actually at MIT right now. So
That's
they're doing
amazing.
studies on Alzheimer's with them, and they're grading. Yeah, so that's
People,
why I went with his bed. I love this bed, and so that's one of the we're excited about the future. Little roads with that one, but he's they're doing wonders with neuroplasticity with sound. And if you
that's
think about
amazing.
it, have you ever seen those videos of somebody playing like they have a puddle of water and then they play like certain frequencies and you can see like the have you ever seen that where they
Uh-huh.
have like different shapes, right? We're what 90-something% water, like as human beings. That's
Yes.
ourselves, right? So
Right.
why would it not work on us?
Yeah, it totally makes sense. And I know when I was going through cancer treatment, I found a whole bunch of really cool videos to listen to the sound frequencies on YouTube. So I always tried to do that. And then like the old tuning forks, I don't know if you
Yes,
use those,
yes,
where
love
you,
tuning forks.
yeah, where you get the
Yeah,
right frequency and then you put them on your chakra points going
yeah.
down. So
Is it gonna cure anything? Of course not. I mean, that's and I'm one of those that my practice. I think that's one of the reasons why I'm very direct and very straightforward. Like I'm
yeah,
not gonna cure. I'm not gonna cure your cancer. I'm not
right.
right, but I'm gonna help you fight it. We're gonna help you along the way,
Mhm.
right?
And
Um,
find ways to heal, right? I mean, you're
find
going
ways
to
to heal
find
your
ways
body.
to,
Yeah,
yeah, exactly.
yeah. I hate using the word cure.
Yeah, I know.
Like
Right.
no, but
Well, because as
absolutely.
long as we're alive, we're going to be dealing with something,
Yes,
right?
ma'am. Oh,
And
thank God somebody said it.
yeah,
Right.
yeah, I got it. I had a lot of hard lessons to get there, Dr. Claudia, but
Right.
yes,
I
I got it.
know.
Um, but peace is momentary, right? We have to, and healing
But
is
soak it in while it's there.
yeah, and healing is an
Right.
everyday task. Like it
Yes.
is not like you don't just wait to heal when you get to a bad point. Like this is why we end up getting to the bad points, right? Because we may not be taking care of ourselves, you know,
And life happens.
yeah,
Life, unfortunately,
and
life does
busy,
happen and busy, right? And
chaotic.
stress. and how much of it is out of our control, right? And
environmental, all of those things.
yeah, there's very
So
little, but
So
go
I
ahead, sorry.
love what you've put together here because this boot camp will really help people feel better physically,
Yes.
and they really 100% will because I've seen another clinic doing PRX and people's skin was amazing. But you're combining multiple things together, the red
Yeah.
light, the CO2,
I'm
and the
excited.
acupuncture.
I'm
Oh,
so excited
let's
about
talk
it.
about
Yeah.
this. We didn't talk about this.
Oh.
Um, Talk about your needle facelifts.
I do offer facelift with needling. And that's just for we call it facial rejuvenation,
Okay,
right? And it was really popular a few years ago.
it was.
Um, like I would say about what 10 years ago,
Hmm.
maybe roughly around there, where all of a sudden, influencers or whatnot started putting these needles in their face
Exactly.
and stuff. And it does work. You need a certain amount of time. It's all about time, right? And I think it's one of those situations where I call it the microwave generation, right? Where we want everything now. It's
Yeah.
like, no, just like with everything,
Right.
it takes a few sessions. But I have seen it work. It's basically needles go in certain points. Of course, we're all trained differently, right? Um, to get the energetic lift um, with the needles and the same with the needles actually create the same concept as micro needling, right? Because we're actually breaking the skin. We're getting into the skin. And so it's creating
Mm.
that turnover of cells as well as that lift. So,
Does it train the muscle in any way, or is it really just the cell turnover that it's
um,
what it's
no,
doing
it's
in
a
the
cell
face?
turnover.
Okay.
Yeah.
Yeah.
I mean, but you
Yeah.
can train muscles. I mean, I've seen yoga. I've seen facial yoga. Have you
I
seen
have
that?
too.
Yeah, where people will sit there and I absolutely believe people can do that. Yeah.
I haven't done it. I'm not that
You look
clearly
great.
I
No,
haven't done
no,
it.
yeah, stop it.
Yeah. I'm not that what's the word disciplined to do something like that,
That
but
and that's you know what who is though
right.
you know
That takes
I
discipline.
it but I give people grace because I think it's a lot of work to be healthy.
It is.
It's
You
a
bring
lot
up
of
a
work.
very good point. You know,
It's a lot easier to just go and get a hamburger.
yeah, no, it's true. You get the
Right,
drive-through.
yeah,
Yeah,
but
it's true.
that's
But
okay. And meet me we that's my whole, I want to meet you where you're at, you know. Yeah,
I love that. And
yeah.
that's what people really want. They want to be met where they're at and you kindly, gently push them just a little bit more than what they thought they could do, I think.
But that's like with anything with
Right.
I encourage women over 40 to go with weight lift. Just try
Yes.
it. Just try it 2 days a week, and see if you like it. And most people they walk. It's just great. Walking is great. But I'm like, try lifting a few weights.
Right.
Try to do a little pump in the iron. And you'd be surprised after a while your body craves it. Right. And I think it's the same thing with supplements. I love supplements. I'm not a big let's push a bunch of them. But if your body needs, CoQ10 or if your body needs vitamin
Right.
C or whatever it is, you'd be surprised 3, 4 months of that, not a microwave, right? 3, 4 months of that,
Right.
you start feeling better. You're like, oh, I actually feel a difference. And so we have to wait it out a little bit. But you develop a habit,
Right.
right? And so it's just like
Exactly.
the habit of having, you know, pizza on Friday night. Okay.
Right. The
You
habit of
develop a
having PRX and red light.
There
Yes.
you go. PRX and red light. It's a habit. After a while, you're like, hey, it's time. People get massages once every,
Right.
it's time for my PRX. Time for
Right.
my it's a little extra for yourself. Yeah.
Now, for the people that are kind of needle phobes and have not done acupuncture before, let's reduce the stress level for those people because
That's right.
talk about how what the width is of most of the
Oh, they're
needles that you
tiny.
use.
They're the size of a hair.
Like one hair, right?
One hair. Yeah, they're small.
And
Yeah.
it's not going very far in, right? It's just
No, it shouldn't be.
mhm.
I mean, it really shouldn't. I mean, since most people are familiar with dry needling, right? And I do dry needling, and dry needling is technique. It's just a technique. That's all it is. It's a different technique that we use. The needles they don't really vary very much. So let's say we're going into a muscle, it's finding that little trigger point, what we call trigger points. So I find a trigger point, I feel for it, and then I needle it. And I don't go in very far. I just go straight to where it has to, and I can actually feel the muscle move underneath my fingers. It doesn't have to twitch hard. I could feel it move very gently, and then I let go, and then so most of the time. when people come see me for dry needling, they're actually surprised at how much less it hurts.
Oh,
Because I,
wow.
you know,
Okay.
because I've developed a technique where it's like, okay, let's just get straight to it. We get it and we're out. So a lot of times they're very surprised that it doesn't hurt. Yeah. When I do
Yeah,
it.
which is a great thing because
Yeah.
if you're in pain, you
But
don't
that's
want to have
years
pain,
of
right?
training, right?
Yeah. Well, and I was just going to say, if she can feel it, then that means that you have some intuition and some, obviously, you understand the anatomy well enough to know, okay,
Yeah.
we've done what we need to do.
I tell people my palpation is gonna hurt more than the needle.
Right.
Because I'm gonna push. I want to feel the striations in that muscle to be able to feel that trigger point. There it is. Okay.
That's awesome. Though,
It
I
doesn't really
mean,
hurt though.
yeah, it is not scary, people. If you haven't tried it, you really should try acupuncture.
Yeah.
It is the best thing since sliced bread.
And I
Um,
usually walk people through the first few needles, and a lot of them are very surprised. They're like, "Oh, I didn't even feel that." I know you won't feel it. Yeah,
Yeah, I
you'll be
know. And
fine.
it's so relaxing. I mean, it's the
Yeah.
best thing you can do for yourself to get on the table. I do,
Yeah.
everybody will ask this question because a
Mhm.
lot of people want to know, is everything you have cash pay? Is some of it covered by insurance? Or do you have like ways to pay things out? So tell us
We
a
do
bit more.
have it is a cash pay unless you're going through the veterans CCN.
Okay, and then they
So
have,
with and they have so the veteran CCN you go to the VA, they give you a coach and then that coach sends us a referral.
okay,
And then we
gotcha.
take care of the rest. And my staff is amazing. I can't like boast about them enough. They are so great when it comes to that. So they get them scheduled, they get them on, and then we get them treated. I don't even have to worry about it. But then that the VA covers that, right? That's for our veterans. We are out of network with most insurance companies, so we give you a super bill, and if your
Okay.
insurance
And then they,
company does cover it, then you send that super bill in, and if they need notes, whatever it is that they need, then we'll take care of that too. But then you send the super bill in to get reimbursed for the cash pay. Yeah,
they could also use the people that have the credit cards for the HSA or FSA, they could use
right. That's
that.
what I was gonna say. Yes, we
And
do take
good.
we do take health savings accounts and
Okay, cool.
yeah.
And do you have anything that pays like where they could pay it out like a firm or something like that?
We're working on that. We're
Okay.
we're 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 working on that, right? We're in the process of doing that.
Okay, awesome.
Yeah.
Well, is there anything that I missed
Um,
about our big event coming up on March
no, but
20th?
I'm excited. I'm actually excited. I'm
Me
like,
too.
it'll be fun. I think it'll be fun. Yeah.
Yeah.
Yeah. It'll I'm hoping that we get quite a people on that chair too. And then
Yes.
I want
In
to
the
fill the
bed.
last few spots of the boot camp. I want to create a little folder sort of women's and their, like to inspire other women
Yes.
mainly, that you're not the only one. You're okay. All that fun stuff.
We're
Yeah.
all in the club.
We're all, I know. It's that's okay though.
It
That's
is.
I think that's what we were put on this earth to do,
Yeah,
honestly.
we were here to
Yeah.
serve people, in my opinion.
Well,
I mean, not I don't mean like
no, I know it is.
in a submissive way. I mean help people, support, encourage,
I think we're the
heal
we're the
yourself.
carriers. We carry everything. Yeah.
Yes, and
We
that
are.
we have to
Yeah.
release.
I know. I know. Or at least find time to take care of ourselves, mainly.
Exactly. And
Yeah.
you will be impressed to know that Dr. Claudia is wearing her workout attire so that she can go lift weights after we're done and
I
take care
do.
of
I do
herself.
try to practice what I preach. I do.
Yeah.
I have like I can't just tell people go do this and then not do it. I've been known to take an herb or two and close my nose
Okay.
and
Well, that
and
is
chug
good to
the
know because there are some smelly ones,
or
but
but they
I will,
work.
I,
Yeah.
yes, they do. And I, I have not had acupuncture yet with Dr. Claudia, but I have had acupuncture many times in my life. But the time that it was the best was actually during treatment. It was the only
Yeah.
thing that cut the nausea.
Yep.
And even with Zofran and all the things, I mean, 2.5 years of being nauseated is really uncomfortable. And I will tell you, acupuncture helped. It's
Yeah.
amazing.
I do
And it
see a
helps
lot
you
of
sleep.
people that go through treatment and all that. Yeah. Because
Yeah.
we're rebalancing. We're literally balanced. And that's one of the things
True.
I like to point out because people think it's woo woo, right? And so we are
No.
working with your nervous system. I always think I like to say that, okay, so 3,000 years ago, over now, they developed this medicine over time, right? With trial and error. They would try these herbs and that herbs, and they would, and either the Chinese, right? Then they started doing needles, and I don't know how exactly how this medicine developed, right? But that's basically the gist of it, especially when it comes to herbal medicine. Well, that one didn't work. I don't know if people died trying it, but
Yeah, probably a
oh, that
few.
didn't work. Let's try this one.
Yeah,
But then they started studying on how herbal medicine, how it tonifies versus, you know, releases, or what's it called? Excess, right? Either tonifies or releases excess, or how it purges the system. If you have like
right.
an illness, it purges the system versus if you're exhausted or fatigued and it tonifies your body. So they started experimenting on all these things, and it's still alive today. The exact same formulas, the exact same, they're still
Right.
alive today. What, 100, 200 years ago, they used to do lobotomies. That's how we experimented in the West, right?
Yeah.
They did lobotomies, they did, all these different, and that's gone. We don't do that anymore. So this one stuck around. So obviously it works,
Well, let's be
right? That's
honest.
my whole thing. That one doesn't work, but that's the way most medicine is, right? As we evolve, whether it's pharmaceuticals or even now with robotics, right? That's the way it
Yeah.
works, trial and error. And that's what studies are, right? Let's try this. But that's the one medicine that has stuck. So
No, it is true, and it is the basis of so many things that
yeah,
we have in modern day
right,
uh Western
right.
medicine.
Yes, ma'am.
Really came from what the Chinese were doing.
And they're trying to, and I mean, and they're still adapting it, honestly. A
Yeah.
lot of, they're still adapting it. So
Hey,
to
listen,
their
I don't know
medicine.
if
And
you've
that's
seen
okay.
this.
I love it. It's like dry needling, it's adapted from Chinese, from acupuncture, right? And so we call it ashi points in Chinese medicine, and they just do it a little bit different, right, with the needling. But they're adapting it. They call it scraping, gua sha. We call it gua sha, right?
Right.
Great for some conditions, it's being adapted over here, and that's fine because I'm personally, I'm like, hey, it works. There's a reason why they're doing it because it works. So
Right. Well, have you seen the commercials on Facebook? I
I don't
had to
know.
join for women over 50 doing the Asian Pilates and Tai Chi.
I haven't seen that.
Oh, it's
Really?
pretty amazing. And I will tell you that I started it this week. I got sucked
Yeah.
into the ads, and it was like 3 months for 19.99.
Yeah.
And I'm like, well, I'm going to
Is it
trust
Tai
the
Chi?
Chinese because they've got it going on. Yeah, it's basically like Tai Chi. They call it Tai
Yeah.
Chi walking,
You
but
know
it's
what I love?
very
Qigong.
relaxing. It's what?
Qigong.
Oh,
Qigong.
Qigong.
I love Qigong.
Yes. Yes.
For my older crowd, because I do see a lot of the older population that don't want to necessarily lift weights,
Right.
which is fine. Qigong is great. It's
Yes.
great, and it
Tell
and it
people
will
what that
build.
is
Yeah,
that don't know.
it's basically the same kind of movements, but it's very very focused,
Yep.
and you're almost in a horse stance the whole time,
Yes.
right? If you've ever sat in a horse stance for more than 15 minutes, it'll build those muscles. And so technically it's supposed to make you stronger. It really is.
It does.
And so I love Qigong. Tai Chi is great. I love Tai Chi. Tai Chi is more of we get to move the whole system, right? That's more of
You're
you're
right. It
moving
moves around.
yeah. Where Qigong is more of like make you strong. Yeah.
Yeah. Do you
Yeah.
think
I
Dr.
love it.
Claudia has a theme? She is strong. She wants to be
Yeah, try.
strong. She likes to, she's
I do.
passionate. She's fiery. We love it. Now, Dr. Claudia, I want to make sure I have the number right, but if anybody wants to call, well, you can just come by on March 20th
Yes.
if you can, or you can reserve your space or reserve your package for the boot camp if you can't come by that day. But the clinic phone number is 830-302-7110. Is that correct? Okay.
Yeah.
And then her website is www.thepointcm.com.
Right.
Correct? Okay.
Yes, the point Chinese medicine. That's what
Is what it
CM
stands
for Chinese medicine. Yeah.
for. Okay. Well, is there anything else you want to share with our audience before we go?
No, I think that's it. Yeah.
I
It's
feel
been
like we went
great.
around the building and all
I
the
know.
things. I feel
I know.
like
And
we
I
went
think
around
most
the
people are
world.
so confused because they think like I do so many modalities. I really don't. I really don't. I mean, it's acupuncture, pelvic floor, right?
And they all build
And
upon each other,
they
right?
do,
Yeah.
they do. And then on the other side of that is the outside, right? We love working on the body. The physical, like the beauty stuff. I love it.
Right.
I don't think there's anything, you know, I don't think it's vanity either. I think it's just that's the nature of the beast is most of us want to like best face forward kind of thing.
Well, I do think also we're wired for beauty.
Why
I mean,
not?
I mean,
I don't
right?
think there's anything wrong with it. Yeah,
Well, think about
I
when you
love
go
it.
outside and you're drawn to flowers or the mountains or the beach or the
Right.
whatever. Like we
I
are
love it.
wired for beauty. So why
And
wouldn't we?
everybody's beautiful.
Yeah,
I love it. I'm just
yes,
bringing it out.
yeah. Oh, I
Yeah,
love that. She's
I
just
think
bringing
so.
it out. She's bringing out your
Bringing it out.
natural stuff. I love it. Okay,
Yeah.
well, everybody, I hope you have a great rest of your day, and I hope that you will
Thank
make it.
you.
If you live in South Austin, Kyle, Buda, San Marcos, New Braunfels, Universal City, San Antonio, there is no reason for you. You are close enough to go and meet Dr. Claudia and use her fabulous services. So, anyway, thank you for spending this time with us,
Thank
Dr.
you.
Claudia,
This
on a
was fun. I
Saturday.
just love talking to you.
Oh, it was fun,
Yeah,
wasn't it?
we always love talking. I always love. Yeah, and we're gonna. We'll talk later about.
Okay, all the things, all the details. Okay.
I'm gonna get you on the table.
Oh, I'll take it. Like you don't
Right.
have to talk me into that. Okay, everybody. Well, we hope that you check out Dr. Claudia's clinic. And
Thank
if you're a
you.
lady or a man, you are allowed to do the PRX boot camp. But
Yes,
this particular one is focused on the lady stories, but you can
but
still
that's
get
okay.
the
Man,
services.
come on in.
That's
We can
right.
do it.
Yeah,
That's
that's
right.
right. Okay, everybody, have a great one. Bye-bye.
Bye.
See.